check with you something for your reference, even for your personal life. I'll show you how it's working quickly. I mean the data view showing how to compare between 2 or up to 4 medication. Let's say we have a pregnant or breastfeeding case and I'm not sure this drug or this drug. Or I have 2 choices, even for myself, let's say, and one of them causing adverse effect or side effect and the other is not. So shall I go with this one or this one? So you can just type here, let's say I will be checking here for warfarin. Okay, and you can add up to 4 medication as it's mentioned here, and rivaroxaban. Okay, 2 medication, same class, and here is the section that I compare with: adverse effect, indicators, pregnancy, lactation, and contraindication. So if I click on compare here, it will be showing these 2 drugs side by side. So let's say if the patient or me, I'm on rivaroxaban and this is happening, I know the reason behind. For hemorrhage here, this is common side effect. But you can go with warfarin if it's an option. And if I'd like to check, for example, for breastfeeding, is it compatible or not? So I can use jump to section, and here it is for drug lactation. So it will be showing here, rivaroxaban is not recommended, but warfarin you can use, but cautiously.
Okay.
Helping some, right?
For our.
Yeah. So this is just for the drug comparison to be aware of this. And the next tool we have, it will be pulmonary monograph. Again, pulmonary graph, it will be for the P&T committee, pharmacist, physician, or the group of clinical team who are responsible to evaluate, review the medication, what is the best. So it will be mainly for this. So this is just to give you a hint. It will not be for the nursing team. I'm not sure if you are involved in the drug use evaluation or medication use evaluation. You are not? Okay, so all this section, it will be for pharmacists, yes, and physicians. Material safety data sheet that we highlighted, it will be just highlighting the hazards, safety, handling for medication. So we can put here the drug name, yeah, and then you can check the safety. Right. So let's say I will put here methotrexate. By the way, part of the name will be accepted. No need to put the full name. Then it will be matching what you type, and here it is. So methotrexate injection. So immediately it will be showing here the safety file, and you can print it out or save it as a PDF. So if I scroll down here, it will be showing for eye contact, skin contact, and so on. Okay, so this is for your safety or for anyone's safety.
This only in English.
Yeah, yeah. This is because this database actually you can see here. This is the logbook. I mean, this is additional website, not under Lexicom. So this is additional access to this. Okay, so for more
I want to
clinical.
ask something. In phone application, we don't have more clinical tools.
Yeah, you don't
Only
have,
on
but you have
PC.
databases. If you go to library, you will find list of databases.
Okay.
Yeah,
Okay.
just covering the more clinical tools.
Okay.
So you might find, for example, toxicology. You will find this under your database. Under library, you will find one for toxicology. So as we highlighted, toxicology it will be for emergency settings. How can you find the antidote for any overdose medication? And household product. Clorox, some cases. So you can just type here, and then it will be shown the chemical ingredient, what is the antidote. Okay? So if I go with overdose of digoxin, what is the antidote? will find it here, digoxin. So remember that Lexitox, it will be showing a different logo. And instead of Lexicom, once you open the Lexitox, it will be converting to Lexitox, just warning you that you are under this database. So there it is.
I'm Bank of Mobiles.
And once you find, treatment, it will be shown here in different style. So you can find the treatment and you can find the treatment antidote. Here it is. Okay, so this is for toxicology module or database available under more clinical tools. So next to toxicology, we have a direct link to Uptodate. So the sister product for disease oriented. So you can access Uptodate from within Lexicom. Click, there is a pop-up window will appear. You can search for any technique, procedure, whatever you are interested to search within Uptodate. Indexes, this is the list of databases under the Lexicom subscription. So here is a list of databases. So LexiDrug Multinational, this is the comprehensive coverage for all medication, okay, for adult. Here for Pedia, Need, and American Hospital Formulary. For us, we will be giving you just a hint, what does it mean, this database, what we are covering, just 2 lines. This is for your reference to be aware of the list of databases. So this is just quickly, and next to more clinical tools here under indexes, we have other clinical link. This is external link. We believe that might be helping the staff looking for SHB, Orange Book, or FDA recall, something mainly
It's
I think
not
for
main, right?
pharmacy, yeah.
Okay.
And the last one, which is really important, the advanced search. To be a super user when you run a search, and instead of having the normal search bar here, you can filter. Let's say we have a patient with renal failure. What is the list of medication shouldn't be prescribed for this patient? Hypertensive, G6PD. This is just an example. I would like to get a whole list of medications that I use for treat specific disease. For us, for our safety, let's say your patient is renal failure. So I will select here the contraindication section. This is just an example how can you use this feature. Limit search to LexiDrug Multinational. And then you will type here renal failure. Enter. Then it will be showing immediately the list of drugs that you need to avoid. So here, top 5, you can show all of them here. And if I select albumin in this list, it will be showing immediately the part here under contraindication, highlighted yellow, renal failure. There is a risk here. Okay? So this is just quickly about the more clinical tools available within the blue bar. Regarding DI or drug ID, you have to leave.
من المور clinical
More
tools.
clinical tools,
Advanced
the last
search.
one, advanced search.
Advanced search for anything, contraindication side effect.
Yeah, you can see the drop down menu. I selected only contraindication. You can select warning, precaution. Let's say I'm interested in pregnancy.
Pregnancy or
You
breastfeeding.
can type pregnancy and warning.
Okay.
We'll get the whole list.
Okay.
Okay. For drug ID, when you deal with a patient and you will ask the patient what is the medication you are following, they will bring tablet capsule in a bag without cover. How can you identify this medication?
We usually throw it.
You usually do this, but sometimes you know what is the patient following to avoid any interaction also. So this is the tool that will help you. What's imprint on the tablet or capsule, type it here. Then it will be giving you a picture of this drug, name of this drug.
This is nice.
Okay, so I will be typing here, for example, it's written S12 on side, and the other side, if I remember correctly, it will be showing 1000.
Those.
Yeah, so I can select shape, color, and all these things, but save your time. If you have many options, then you can go with limit. And then I will click on search, and I will see if it's recognized. So I'm showing here. So this is for that.
Metformin.
This, I mean, this is Syngard. I mean, yeah, it's the same. I mean, yeah, it's for diabetic patients. Yeah.
This is nice.
Okay.
All medications مكتوب عليهم أقرأ؟
I think
Not
not
all, not all of them. Some of them it's just plain tablet capsule without anything. You will not.
Lexicom, we should scan the tablet.
This is nice. You
Yeah.
should add the option to scan.
No, or maybe you crush it and put it on the
مش لهالدرجة.
DNA. Okay. So this is the way for drug ID. For patient education, which is really important, as this it will be covering different areas, supporting multiple language, saving your time. So here I can create my own. Let's say I'm working with, dealing with emergency setting. Eugene, did I ask you which unit you are working for?
ICU.
ICU.
Yes.
Okay. So let's say, for example, I'm dealing with high alert medication, and I would like to get all the information about this medication in one place. When I need them, I can open. Okay? Or any case, I'm interested also to have patient education about my normal cases. How can you make your own collection, save it, you can access it 24 hours, anytime you need it, with one click. You can have it here in Lexicom. So let's say, for example, I will go with warfarin, and you will see here when I search for warfarin, it will not show only warfarin information. I will search warfarin, it will be showing anything else related. Like, for example, going home on a blood thinner,
Okay.
vitamin K diet under health style, adult medication, or pediatric. So all of these will be available also and supported with multimedia, which is really great. Which food that has, so this is really great for all patient education
هاي
activities,
يصير بالعربي؟
and you can get it up to 20 languages: Tagalog, Arabic, Bengali, Chinese,
Korean.
and oh,
Korean.
Eugene, you are Korean.
Yes.
Ah, I should. Yes, that's one. Sorry. It's my mistake. Okay, so you see, here it is. So I will select an option here showing how can you change the language from here, and then you will go to the list.
Oh, there's
So,
Korean.
Korean.
That's good.
Yeah, I mean we don't have much in Saudi Arabia, Korean. Yeah. Anyway, so if I show you this in Korean, for example, going home on a blood thinner, so I can click on left review once I select this language, and then you will get
Oh,
nice
translate.
algorithm here.
Interesting.
Okay, so this is the way, and you can get it up to, I said, 20 languages. So let's say I'm interested in this. So click on add to bucket. Vitamin K, yeah, add to bucket. Warfarin, add to bucket. Let's say this patient also is diabetic.
What does that mean?
Or does it
We are
mean
sending
sending to the basket? Sending like
Like
shopping.
shopping.
Exactly.
Mm.
Sending to the basket. Then you
I
can
can access
print them
it.
all
Okay.
or save them all for the future. Okay? So if I will go with hypertension, This is a tricky point. So I selected Korea, and it's showing
Unavailable.
not everything. Not everything will be supported in multi-language or 20 language. Some, which is the common. But medication, 100% is covered. Okay? So what does it mean? Asterisk, it's not available. I mean, for example, here for malignant, it's available. Okay? So that's why it's tricky. When you read this, it's not available. You leave it. No. Only the asterisk. This is available. Okay? You got the point. Okay, so let's say, for example, add to bucket, this one, and this I add to bucket, and the malignant one add to bucket. Now I have all of them here added, and I'm not sure if you are allowed to put some notes for the patient. I'm not, for example, take before the meal, during the meal, with juice.
Instructions.
You are doing this or advising? Okay, so if you would like to add these notes here, you can do.
Okay.
If I select this option, packet summary, check this one, then go to preview current packet. So preview current packet will enable you to put your name if you want, put your patient name, put the instruction here, whatever the language you would like to add. So it will be combining with the whole list of pamphlet before you print it out for sharing with the patient.
Okay.
Yeah? So we can put it here.
Need to practice.
Okay, now you spend time creating this collection, right?
Yeah.
No need to do it every day. If it's common, create it and then go here under store packet. Okay? And click on store, and then you can type, just identify it. So let's say
Hypertension.
for sorry?
Hypertension.
For hypertension. So we'll go with hypertension, and maybe one of my colleagues will create the same. So I would like to identify it. I can put my name next to it. Okay? So I'm not remembering OUJIN.
My
Your
name? Y-E-O.
Y, okay, sorry.
Y-E-O-J-I-N.
J-I-N, okay. So then I will click on store packet. Next day, next week, next month, I will open Lexicom. Where is the ones that I created today?
Research.
You will go to patient education, under store packet. And here is the one. Okay, all what you need, just click load. It will be loading here under this tab. Under preview current packet. Yeah, and then you can
Change
open.
patient number, patient name, and
Yeah,
okay.
you can edit from here, exactly. Okay, so this is for the patient education, saving your time, create your own collection to access. For some other tools under calculators for the nursing team, you can find different categories here. So if I select, for example, conversion, here, by the way, we have category for adult or pediatric if you are dealing with any of these population. So I will click on conversion.
From milligrams to.
Yeah, and sometimes it's also giving you equivalent. I know this is for physician and pharmacist. Let's say, for example, we have shortage of cortisone. What is the equivalent of prednisolone?
Okay.
What's the amount? It will convert it to you. So here for conversion, yeah, as I said, glucocorticoid. But here, as you mentioned, for body fluid or chemistry value, we have also for drugs. So if you select the drugs conversion, and here it is. So from the drop-down menu, so let's see, we have here amikacin microgram. I would like to convert or check that micromole. Here it is. Just put the amount, immediately it will. You see, here it is. So here is the conversion from units. For infusion rate, we already have it here. So we can just calculate the infusion rate. Also, if you are dealing with emergency cases for code blue, what is the list of calculators? So here is a list of medication that you can use the infusion rate calculators. So for vitamin, just put the amount, let's say 400. Infuse volume 100. Wait for this patient 80. Dose 9. If something is wrong, you will find a correction will be showing. If everything is okay, you will find the result straight away.
موجودة nutrition products
No good?
nutrition products formula
Yeah. Do you have any specific examples that you can
protein
say?
لا مثلا ايه مثلا بروتين او glucose
How can? Sorry?
هي اشياء نعطيها للبيشنتس
Pediasure.
ICU pediasure
Formulas.
This is
Formulas.
Formulas, yes.
Okay, I don't think so that you can find this here. So, even if I select the pediatric one, if I select the pediatric, I'm not sure that we will not find something will help me with this. So, but anyway, we have the category. In some calculation, it will be showing the formula that so I will select here for pediatric. So it's upper CDC. Okay, so this is the type of coverage. So for interaction, we will be highlighting quickly the safety medication tool to avoid any interaction, and we are saying here medication without harm. So you can just check here the list of drugs to check if there is any interaction, is it safe to combine, if the patient has allergic, and also duplicate drug therapy. Let's say by mistake I will be adding here generic and trade, and if this is duplicate or overdose, you will find a warning telling you that this is an overdose using this medication. So I will be adding here augmentin. Okay, so this is just examples of medication, and I can also add here the herbs. So like for example, green tea. Aspirin. And warfarin. So this patient has allergic to penicillin.
This is the interaction, right?
Yeah, this is the interaction.
Okay.
And also this patient has allergic to sulfur. Okay.
إذا عنده allergy. إذا ما عنده خلاص.
ما احنا بنحط هنا لو هو عنده الرجي احنا عارفين احنا يا اما بنساله او الهيستوري بتاعه منشن. احنا عارفين ان ده البيشنت ده عنده بنسلين الرجي وعنده سلفا الرجي فهنضغط على analyze. What will happen? It will be showing here categories. If there is any drug allergy that you should avoid, so it will be showing here augmentin, bactrim shouldn't be given to this patient because there is allergic to
Sorry,
penicillin.
can I ask? Drugs, we add how much drugs?
Unlimited.
Unlimited.
If you have in emergency settings, how many? You can add 12, 14.
طب sorry, can I add the allergies that would analyze without adding all drugs?
You mean that you would like to just
Only
add
مثلا allergy to eggs.
Okay.
Okay, and analyze. وهو بيطلع لي شنو الدراجز اللي ما بقدر اعطيهم بالاجرام.
No. For allergy.
Lexicom ولو.
Yeah. For allergy, you can do this for the drugs
Okay.
and herbs.
Okay.
But for the allergy, no.
Okay.
But the other option that might help you with that is what? Let's say, for example, this patient has allergic or body response to strawberry or banana.
Okay.
Okay? So if it's not showing here, we have a database called natural products
صح.
under Lexicom. And you can find it under your list of databases. In that case, I will open or put it here. Just type banana.
Names.
Exactly. On the search bar, then it will show you list of drugs, list of hair, body response, reaction, and all these things. Okay, so here, aspirin with warfarin. Okay, so you will ask me the risk rating tier. By the way, any clinical tools within Lexicom, you will find help. So you might, I need more information. What exactly monitor therapy mean? Or consider cell modification. So if you click on help, it will give you the full definition and more information. And remember, this will be with every clinical tool that we have it here in the blue bar. So if you go down, you will find this list. You see, this is the full definition for these risk tier categories.
A, B, C, D.
Yeah.
Means from A.
Yeah, A and B, safe. No interaction, no action needed. C, starting from C, monitor, then the risk, then the most severe. Exactly. Yeah. So you have it here. And you can do this for one single drug. Let's say I would like to check for everything for vancomycin, for example. So once you click on vancomycin, this is what you are interested in to get the whole list. So BCG or cholera vaccine shouldn't be combined with vancomycin. And here is the risk of D and then C and B. Okay, so this is for one single, and you can print this list or you can filter. Let's say I'm interested only in X. If I have a huge list, so you can filter it from here and select X only. Then here is the X only.
Okay.
Save your time. Okay, so this is just
Can I
for the-
save this also?
No,
Okay.
no.
Every
But-
time I should put
Yeah, you can print.
enter that. Okay.
Yeah, you can print because you know sometimes it's changing.
Okay.
Sometimes it's X right now, and some change maybe next month, some improvement might be under D,
Okay.
and we have this.
ونقدر نغير اللانجوج.
For the language here, it will be available in English because this is, will be for all
Not
clinical.
for the patient. This
Yeah,
for
this
our
is for us.
knowledge.
Yes,
Okay.
exactly. Yeah,
Only in patient education we can change it in all
exactly.
languages.
Only patient education. Yes. You can change the interface, but this is will not help you. I mean, in our region, you can change the interface in other. I mean, if you are a Korean or I mean Spanish or Deutsch, you can change the interface, but the content still it will be remain in English. Okay. For tracer IV to check the stability compatibility between IV drugs and solution. So you can check here this tool if we are dealing with heparin.
And for the months, for example.
And
two medications we can add, or
at
medication and
least,
solution.
yeah, you can just, yeah, you can select one single IV and solution.
Okay,
So
and
let's
I
see
can select مثلا two medications.
You can select two medications.
Lasix and heparin.
Okay, so we'll be going with furosemide and heparin. Okay, so once I click, I will be adding here. Okay, this is right. I mean, this is really interesting example. So you mentioned Lasix. So if I type here Lasix, it will be showing. Yes.
Generic will.
Yes.
Trade.
Why? Because
they-
it's common.
Okay.
If it's not common, then you have to select the generic.
Generic name.
Yeah,
Okay.
this is the rule. For the main search bar, this is a good point. For the main search bar, you can search by both, whatever. But in the tools, better to go with the generic unless it's common. Like for example, Nexium or Omeprazole.
Okay.
It's common, like Lasix. Okay. So here is Lasix. So this, I mean, you will check this only two, right? Without any solution.
Yes.
Okay, I will click on Analyze. It's compatible all the way. Y-side, admixture, syringe.
Give them together.
يعني I can keep them
You
in
can-
the same IV line.
We can leave them in the same syringe.
Okay, okay, perfect.
Yeah.
Not only IV line.
Yeah, so you can
Thank
find,
you.
yeah, if I select here
Mix
syringe.
them.
الحمد لله ارتحنا منيح. نعم نمسح. تعرف الطوارئ يعني التخبيص اللي بالطوارئ.
Okay, so if, I mean, yeah. So here, it will be shown, I mean, I selected syringe. So two of these studies showing compatible. And this is the concentration, 20 milligram per 2
Okay.
ml and 5 milligram per 0.5. And here for the unit for heparin, and if I click on compatible one, it will be shown here.
هذه حل التركيبات بس if you're giving in a polysac مثلا lasix IV push
Okay.
بتعمل heparin flush للpolysac you can flush.
You can flush exactly. حتى مثلا في عندي انا medications بالemergency مثلا اوقات بعطي زوفران اللي هو اندستيرون وسكوبيران وبريمبيران مثلا for example او اوميبرازول.
Nexium is not compatible with
Yeah, this is the tool that will help you to do this.
IV.
Nexium IV is not compatible with any
Any-
medication.
على فكره بيعمل كمان بيربل كولر على شو اسمه اذا اعطيته مع ديكستروز.
I think Nexium is not compatible.
طب
with
طالما
عنده
انتوا جيتوا بقى
بلازما.
في الحته
Rising.
طالما جيتوا في الحته دي بقى هندخلنا في حته ثانيه خالص. Okay, so I think also you might be interesting if you are doing or going with Y-side case and you would like to avoid crystallization and you need filtration to be considered.
ابانيوتن
Or mannitol, for example.
او اميدارون.
Yeah. So you need to consider, or you need to find information related to this area. Where you can
Search.
find it.
Search. Or
No,
database.
it's a little bit hidden where you can find this. So I'm interested to check what you highlighted for omeprazole, that it's
Nexium.
incompatible with
Nexium.
Nexium. Okay, so I will check. Okay, let's try here. If I will type Nexium, it will be recognized.
لا ممكن يكون دراج من دراج. انا كنت بعطي
Yeah, okay. So we have here
Nexium IV.
Nexium,
Nexium
IV. Okay, the same list. Okay, analyze. With, I mean, Y side compatible with Lasix. Yeah. So, let's say I will click on Nexium here, IV. So, once I click here on Nexium, you will find here a new tab appear, properties. This is the additional information about the IV, see, formulation, reconstitution, stability.
Infusion time.
Yeah, and here storage, life effect.
Nice.
This is hidden information. You will not find it under the drug monograph, but you will find it here under the recipe. Okay? And yeah, regarding the part for filtration, if it's applicable for the drug, you will find filtration will be
Okay.
shown. Okay. So I remember a case for many tools that it need filtration. I'm not sure if you have any other case or not that we can try it here. Sorry?
Hamilton or Cordarone, no, Amiodarone.
Amidalone.
Yes.
Okay, so we go with amidalone.
And solution or other medication.
Yeah.
Same what? Oh, not dextrose. D5. Yes, D5.
Okay, so if I click here on amidalone, you will find here the tab will be showing amidalone the same way. And here you find the filtration section.
The
Here shown.
use. For the
Okay.
use of an inline. Okay.
Okay,
Okay.
so this is the benefit of having this. If you would like to check one single IV, you can just click on, let's say, amidalone. Check all IV, all solution, all methods. So you have the filter here. So if I go with the filters of all methods, so I can select solution only or admixture only. I'm sure that you know the difference between solution only and admixture. If you are not sure, is it, you mean biggie bag, 2 drugs in a solution? Remember, help will be giving you the definition of what does it mean, this combination list. Here it is. So what, Y side, solution, admixture, and CH. Okay? And what does it mean, the compatibility, compatible, incompatible, the colors of the compatibility chart that it's showing here, red, orange, green. I mean, to make it easy for you, you can just consider it as a traffic light. Green, go, compatible. Red eye, stop, incompatible. Orange, you need to double check. Okay? So this is the way how can you check the compatibility and how can you do this for one single drug. Okay, so this is for the terrestrial IV. We already highlighted the interaction, patient indication, calculators, more clinical tools. The normal that you will do, the normal what you will do is searching for the drug.